Hi, my name is Ava Gleckler, and today my presentation is on rehabilitation and what it has to do with well-being. Rehabilitation is important in our criminal justice system, especially because it helps inmates have a better sense of well-being and helps them once they are released from prison as well. Many inmates suffer from mental illness and develop a low sense of well-being while incarcerated due to inadequate treatment efforts. And then many people also lack a support system to help them once they are released from prison. My chosen article today is titled Increasing Subjective Well-Being in Long-Term Forensic Rehabilitation, Evaluation of Well-Being Therapy. This was a study conducted in a prison with 14 male inmates who suffered from mental health disorders. They were asked to attend different types of therapy sessions, which aimed at specific treatments for well-being as well as their mental health symptoms. And it was found that by the end of the treatment, these participants reported reduced feelings of hopelessness and increased positive future thinking. The aim of this study was to see if subjective well-being could be increased in a forensic sample, so in this case it would be those incarcerated inmates with mental health disorders. Goal setting and planning skills were chosen as a target intervention. There has been strong empirical evidence that the present and attainment of valued every life goals is associated with high levels of well-being, and planning is helpful in everyday life as well. 14 mentally ill offenders from a medium security prison were chosen to participate in this intervention, and the primary diagnoses for these inmates was found to be schizophrenia and bipolar disorder. 3 key points that were found throughout the study of relating to well-being are positive future thinking, less feelings of hopelessness, and decreased negative feelings of psychosis. Why is it important? For positive future thinking, many of these sessions were found to be focused on goal setting and developing skills to help them when they are out of prison, and these skills could also help them in prison as well to better their well-being. These inmates who went through these therapy sessions began to look forward to their futures and feel more confident about them as they were eligible to develop skills, set goals for the future so they had something to look forward to, and the skill set to be able to attain those goals. The second point is important. It is the less feelings of hopelessness. When building these useful skills and learning how to goal set for life outside of prison helped inmates to report feeling less hopeless about themselves. Being less hopeless and feeling less helpless helped to increase self-worth and well-being as you were able to develop new skills and learn new things. These skills are useful for inmates to feel more independent, know how to get a job, know how to take care of their mental health disorders outside of prison, especially if they don't have a support system of their own, and makes them feel better about themselves in that way. The last point today that was found in the research article was it helped find decreased negative feelings of psychosis. Negative feelings associated with psychosis typically include depression or anxiety, as those are common factors and feelings that people have when they have low well-being, whether it's a cause or effect of that well-being. When people have low sense of well-being and self-worth, it makes them more susceptible to depression and anxiety. Being incarcerated as a mentally ill person already increases vulnerability to these things, and they are super common within incarcerated populations. Developing tactics to help people have the ability to navigate around these feelings is essential to one's sense of well-being. Depression and anxiety are negative feelings and typically do not correlate with a positive well-being about oneself. So my article today was related to one of the class articles found in Module 7 on the impact of psychological treatment and making changes on well-being. This article related to mine as it found that mental illness and well-being do require intervention and rehabilitation in many cases, especially for those involved in the criminal justice system who already have a lack of support and treatment efforts anyways. Different types of therapy are useful depending on the situation. There's cognitive behavioral therapy, psychotherapy, or just regular goal-setting, life skills building therapy. Therapy, intervention, and rehabilitation have been proven to be effective and help increase one's self-worth and well-being. To wrap up my presentation and conclusion today, rehabilitation and therapy are essential, especially in the criminal justice system, and then especially for those who suffer from mental illness and psychological disorders. Typically in prisons, there is not an adequate or effective treatment for people with mental health, and therefore reoffending rates are high, especially amongst those who suffer from psychological disorders. Those who have an effective rehabilitation experience are less likely to reoffend once they are released from prison initially, and then they also are shown to know that they know how to get the help they need and use their new skills for life outside of prison once they are released. My article today was found to be peer-reviewed, as I found it from the EKU library. I made sure to check the box peer-reviewed when searching for these articles, and it also gave many references to the research, as well as the authors of this were also a part of the university that the research was conducted at. And these are my sources. Thank you for listening.